Hi everyone, Dr. Esther here again from Cambridge Cat Hospital. Today I wanted to spend a little bit of time discussing unexplained weight loss in older cats. So every year, hopefully we're going to have you bringing your cat in to the clinic for a yearly checkup. And one of the components of the yearly checkup is going to be that we're going to weigh them. We're going to use our scale. And then in younger cats, you're going to notice that we're going to be really monitoring for weight gain, and we're going to be concerned about weight gain, and we're going to discuss strategies for not letting cats become overweight. Then as your cat gets older, maybe around the age of 10 to 14, one year you might bring them in, and we might put them on the scale and find that they've lost a bunch of weight, and then we're going to be all concerned. And you're going to think to yourself, but all these years they've been telling me not to let the cat gain weight, and now they're upset that the cat lost weight. So the reason for that is because there's a difference between unexplained weight loss and healthy weight loss. So in order to get healthy weight loss in cats, you usually have to put a lot of effort into it. So you have to be measuring their food really carefully and putting strategies in place to get more exercise, like playing with them more. Whereas with unexplained weight loss, you won't have changed anything at home, and you might notice a few little abnormalities in the cat at home, usually subtle things, and they'll just have lost some weight, and it's usually a significant amount of weight, up to maybe 10% of their body weight or 20% of their body weight, a significant amount of weight. So in these older cats, when we get this weight loss, when you haven't been trying to get them to lose weight, there is a good chance that there is an illness going on. So at this point, the first step is to have them into the clinic and weigh them and compare their weight to their previous weights. And we'll see a cat who used to be 13 pounds and now they're down to 10 pounds. So 10 pounds is still a normal weight on a cat, but that's a significant weight loss if you haven't been trying to get the weight off. So at that point, we're going to be doing a detailed history on your cat, and then I'm going to be performing a nice detailed physical exam like I've shown you in a previous video. So in the history, we're going to ask questions about things like how much water they're drinking, how is their appetite, how is their energy level, are they doing any vomiting or diarrhea, those types of things. Then I'm going to perform my exam. On my exam, of course, in these cats who've had weight loss, one of the concerns, I'm sure you're going to be concerned about the idea of the possibility of cancer. Cancer is actually a rarer cause of unexplained weight loss in a cat who's otherwise doing pretty well. It's not something I see very often. If I were to see that, I might see clues that that's going on my physical exam. I might find an abdominal mass or feel enlarged lymph nodes. So more often when I'm presented with an older cat who's losing weight, I might find some subtle little things on the exam, but they're actually looking pretty normal to examine, other than the fact that they're becoming thin, and so, that's a concern. So at that point, we're going to want to do blood and urine testing to look for two specific diseases and other diseases, but we're going to be really concerned about two diseases: feline hyperthyrioidism and feline chronic progressive renal disease. Renal disease meaning kidney disease. So at that visit where we've found the weight loss and we've done the checkup, we're going to take the cat and we're going to take blood and urine samples, and we're going to send those out to the lab. When I get the blood results back, I'm going to interpret them carefully and call you with a treatment plan. The thing is, with these two diseases, the hyperthyroidism and the kidney disease in cats, they are very manageable. So there are many things that we can do to get these cats feeling better. There are medications and prescription diets. Hyperthyroidism always usually requires medication, or there are a few other ways of treating it. So here, I'm going to show you an example of some blood work that we did on an older cat. He's about 14, and this cat was actually an obese cat, and then in the 6 to 12 months before he came to the clinic, he had lost about 50% of his body weight. So he had started out as like a 22-pound cat, and now he was down to around 13 pounds. So he'd really lost a lot of weight. And as you can see on the blood work, I'm going to get you to focus in on this T4 here. That's the thyroid hormone level, and if you look at his thyroid hormone, it's up at 120.3. The normal range for the thyroid hormone is between 10 and 60, but I don't actually like to see that number any higher than 40. So based on this blood work, and there are also all his other blood enzyme levels. So we've got protein levels and liver values and kidney values. Everything else is normal. So in him, I'm able to diagnose that he has feline hyperthyroidism. On the blood work, if I were looking at a cat with kidney disease, I would look at these two enzymes here, the urea and the creatinine. In a cat with kidney disease, we would see elevations in the urea and the creatinine, and we would also look at the urine testing, and that's going to give us some information about the kidney function as well. So putting together those things, we're going to diagnose kidney disease. In the next two segments, over hopefully the course of the next week or so, I'm going to publish a couple more segments and I'm going to specifically do one on hyperthyroidism and one on kidney disease. I do want to show you that in this cat who had the thyroid hormone level that was very elevated, causing him to lose weight and not feel very well, we treated him with medication, and 4 weeks later we checked his thyroid hormone level again, and it was down to 19.1. So that was much more normal, and he was feeling a lot better, gaining some weight. His owner was really pleased. All right, thanks everyone, and I'll see you again soon.